Hello and welcome to the agenda. I am Ajay Kaul. In this program today, we will be discussing the issue of overcharging by private hospitals for COVID treatment. As corona cases continue to rise in the country, there is an increasing need for urgent treatment for patients in the hospitals. The government hospitals are not able to meet the increasing requirement, and thus the role of private hospitals becomes crucial. However, there are complaints and reports that private hospitals are charging exorbitant amounts of money, and as a result, many people are not able to access the treatment. Many patients, in fact, have died as they failed to get the treatment in time. In the agenda today, we will discuss this issue threadbare. We have with us Supreme Court Advocate Mr. Shashank Deo Sudhi and Chairman of Hospital Board of India, Dr. V.K. Monga. But before we welcome our guests, let us have a look at this small report.
While lakhs of corona patients are searching for proper treatment to save their lives, private hospitals are cashing in on this crisis situation by charging exorbitant amounts of money. Some private hospitals reportedly had put up notices regarding the rates for treating corona patients, which went up to even rupees 75 lakh for some days of hospitalization. Most of it was to be paid upfront during admission. Some specific cases have also been reported where corona patients had to suffer additional shock of shelling out huge amounts of money for getting treatment in a private hospital. A slum dweller of Dharavi in Mumbai alleged in Bombay High Court that a private hospital in the city charged him 12,50,000 and threatened him with discharge if he did not pay for his corona-infected son. He ended up paying 10 lakhs by borrowing money from friends, relatives and neighbors. Last month, a 76-year-old man succumbed to the virus following a 15-day stay in the ICU of a prominent private hospital in Mumbai, which reportedly saddled his family with a bill for rupees 16 lakh. The family was quarantined at home while the man was hospitalized and had to pay rupees 60,000 online upon his admission. There are many other such reported cases. Often private hospitals make a personal appraisal of a patient to ascertain whether his or her family would be able to afford the treatment. If they discern any inability, the hospitals feign unavailability of beds. The government, which has failed to provide public health care facilities adequately, has not done anything to rein in the private hospitals from overcharging. This prompted a lawyer to file a public interest litigation in the Supreme Court seeking a direction for capping of the charges for coronavirus treatment. The top court has taken cognizance of the situation and expressed concern over it. It has asked the central government to see if directives could be issued to the states. The issue of overcharging by private hospitals for COVID-19 treatment has been taken to court, including the Supreme Court, by many petitioners. Advocate Sachin Jain also filed a petition in Supreme Court seeking regulation of COVID-19 treatments costs across private and corporate hospitals in the country. He sought directions from the top court for the government to issue notification regarding nationwide cost regulation for COVID-19 treatment at private hospitals. While hearing the PIL, the court held that no individual should be denied treatment due to high rates. Chief Justice of India S.A. Bobde said, "We agree that the cost of medical treatment should not act as a deterrent to access to medical care, and that no one should be turned away from doors of healthcare institutions as costs are too high." He added that there is unanimity that cost of treatment cannot be same in all states. Thus, it's ubiquitous to impose a ceiling on the cost of treatment. The court granted time to the government to meet all the concerned parties of the case and come to a mutually acceptable solution. The centre said it has no statutory power under the provisions of law to direct a charitable or private hospital to give free treatment to COVID-19 patients. The centre added that it is the state government which could possibly issue directions to the hospital. The court said, We don't think the union should regulate the price of treatment. But this is not to say that the union government should do nothing. There is no reason for the union not to exercise powers under the National Disaster Management Act 2005, the bench noted. Senior advocate Harish Salve, representing private hospital, opposed setting of rates for COVID treatment and argued that government could not direct private hospitals to set fixed rates. He argued each state is grappling with its own problem. It is not that hospitals are here to make profits from this situation. Their staff salaries have been doubled. COVID patients' treatment is different with use of ventilators, etc. You cannot simply say that one pricing should be there. The court in its order took a note of the submissions by the centre that the underprivileged are covered under Ayushman Bharat scheme. But it seems that due to lack of political will, no consensus has emerged on the issue. While the matter is sub judice, corona patients continue to suffer. Bureau Report.
So let us welcome our guests. I will begin with Advocate Sudhi. Mr. Sudhi, you have filed a PIL in the Supreme Court seeking free trials or free testing for COVID patients. There is another PIL which has been filed in the Supreme Court which seeks capping of treatment charges for COVID. Why are such petitions and such PILs necessary? Why are these necessitated?
Few will dispute that we are facing one of the unprecedented global crisis of our generation. You know, the people are dying. You know, the facilities, so far as facilities in the health sector is concerned, it is inadequate. Everybody knows this particular fact. The public interest litigation is a mechanism through which one can approach to the Honorable Supreme Court in case there is a crisis of unprecedented nature. The problem which the country is facing is that the people are being denied the accessibility of the hospital if a particular individual is having COVID-19. It is undoubted, and it is, in fact, it is a matter of record that 60% of the hospitals are from the private sector. Only 40% hospitals are from the government sector. Naturally, the people go to the private sector. And nowadays, what is happening, actually, there is a blatant commercialization of the hospitals. You know, the people who are going to the private hospitals, they are being charged exorbitant amounts, which they are unable to pay. In that particular circumstances, I approached the Honorable Supreme Court that it is a social crisis. It is the constitutional obligation of the government to provide the healthcare facilities free of cost. The Supreme Court heard our petition and granted the payer and directed the government to provide a free testing, because here it is not a luxurious testing. If one individual will not get tested, it will be posing a threat to the society. So it's the obligation of the government to contain this pandemic. Unfortunately, after 3 or 4 days, somebody had filed application for modification of the order. However, the Supreme Court was adamant on the fact that it is a crisis. I mean, you have to do the testing free. And of course, there was some modification, but ultimately the Supreme Court had stated that it is the obligation of the state to protect the citizen of the country. So the public interest litigation is a mechanism where the government where the people feel cheated and the government is doing nothing. So where the people will go? The people will go to the Supreme Court or High Court. So therefore, the Supreme Court had already taken cognizance of the fact what the government is doing. If the executive and legislature is failing in its duty to protect the people of the country, it is the court who will come down and protect the interests of the citizens of the country.
So now let us turn to Dr. Monga. Dr. Monga, why should such PILs be filed? Why is it necessity for filing these cases? Because why should we understand that private hospitals have to earn, but why should they charge exorbitant amounts?
I do agree and Shashank Bhai that hospitals should not charge exorbitant amount. That is one part of the story. Now let's come to the point first. You asked that why should a person file a PIL? You know, some PILs are really very necessary for court directions because at some times the administration or the bureaucracy, they are not able to cope up with the situation. But at the other time also, I believe some people go for a PIL route just to gain TRP. That is another part of the story. Now coming to this crisis, it's a big crisis. I admit it's a global crisis, and India is also reeling under the impact of this. Basically, Article 21 ensures good health to everybody. That Mr. Shashank will also agree. But the point is, over the years since independence, our governments have not been able to cope up with the population, with the health challenges of the country. That has been happening. So as of now, that gave rise to the commercialization of hospitals. Otherwise, I mean, it's a basic thing. We all agree to that. Now there are two types of hospitals in the country, two types of healthcare services. Number one is the government sector. Government sector, I mean, I must tell Shashank ji that nothing comes free in this world. In these government hospitals also, he will agree that they did a survey in AIIMS and another hospital in Delhi. The cost per bed 10 years back was 50 to 60,000 rupees per bed. That is what we are paying, you and me are paying. And on the other side of the coin is the private sector. Private sector over the years has come up to a level which is comparable to the best in the world. Even in this corona, when the government everywhere in the country is boasting of their infrastructure, their facilities, but their occupancy is 50%, that Shashank ji was also agreeing. And private sector occupancy is 90-95%. Why? That is the reason. I mean, it is not that people are not knowing anything about it. Now, in fact, in the last 3 years, and if you go back even around 10 years back, we were talking to the government as to the costing procedure which should be adopted by the government for private sector, so that we know that what is the cost of a treatment, what is the infrastructure, what are the facilities over there, what is the seniority of the doctor over there, what all they are offering to the public, and then their recurring costs, their medicine costs and everything. But government has not been really enthusiastic about it, and that is why all this is happening at this time. Now, the issue is, even in this corona time, in spite of the fact that these private sector hospitals are under a lot of pressure financially also, but still the government has come up with a rate list. That was not really very good, but private sector accepted it. Okay, government is given, and it is a time we must serve the country, must serve the public also. And in that, the rates are very meager. But as far as the PIL is concerned, I believe, somebody has to pay the bill. If our advocate friend wants that it should be free, let the government pay. Let the government make all hospitals free in a way that there is no house tax on them, there is no electricity on them.
Dr. Monga,
Let me complete.
Yeah, okay.
Sentence, one more sentence. And there is a lot of morbidity in these hospitals also. So many of our nurses and doctors are falling sick also. And the senior doctors are, so many of them have died also. So somebody has to pay, somebody has to, put the bill for all this. We'll be happy if the government says they will pay you all these hospitals as per the rate.
Dr. Monga, as I said earlier, private hospitals have to earn, isn't it? So, but the issue, the PIL is not about giving free treatment. It says there should be a cap on the cost. You can't
That is
charge.
already there.
I'll tell you. I have seen some reports. One private hospital is saying 75 lakh rupees for treatment of COVID for 10 days. 75 lakh rupees. So isn't it too much? And exploiting the situation in this pandemic, amidst this pandemic, do private hospitals have no role? Private hospitals have been given land by government almost free. So in this pandemic, in this crisis, do private hospitals have no role to the no responsibility towards the people or the country?
I agree. I agree.
So
with you.
should they not cut costs, or should not they reduce their treatment costs?
My first sentence was, if somebody is charging exorbitant, we are not with him. We are not with that hospital. But 75 lakhs, I don't know, but whatever you are saying. And then I must correct you here, that not all the hospitals of the country have been provided free land. Not all. Very few hospitals in the country have been provided free land. And in lieu of that, they have to see 25% in OPD and 10% patients in indoor also, which is free of cost. And on top of it, the schemes like BPL, the schemes like Ayushman Bharat, they are really not at all lucrative. But still these hospitals are adopting in the interest of the public health. And that they have been contributing for many years. But if somebody is charging exorbitant 75 lakhs of rupees for a treatment, we are not with them. That has to be really deplored.
Yeah, that is the main issue. That is why the PIL has been filed in the Supreme Court. Let me turn to Advocate Sudhi. See, as I asked earlier, why should there be a need to file PILs? Isn't it the responsibility, since you are a lawyer, isn't it the responsibility, basic responsibility of the government to provide health care? Is it health care a fundamental right? Isn't it the duty of the government to, cap these charges, costs, and be active rather than be inactive?
With all due respect to the concern being expressed by my doctor friends that there are nothing comes free, but the fact of the matter is that I have a Constitution of India, so Article 21 of the Constitution of India, directed the state to perform their obligation. If the state will not perform the obligation, an individual has to approach the Honorable Supreme Court to enforce that particular obligation. I do not have any issue with the private hospital. I have a grievance and I am going to the Honorable Supreme Court to remind the Supreme Court the solemnity of the duty that you owe towards the government or towards the people of the country. So what I am trying to say, look at, you are not really, you should not cite one example. There are thousands of examples which can be illustrated before you, where the private hospitals are overcharging, the people are dying. They have to sell their houses to pay the private hospitals. They are airing hospitals. I am telling you, I have my sources who are telling me that the private hospitals are in fact looting, from the common people. They are aware of the fact that 60% of the hospitals are from the private sector, only 40% are from the government sector, and therefore they are taking advantage of the penury of the common people, and they are doing all these kind of things. And therefore, the public interest litigation is a real mechanism through which these kind of excesses can be contained and can be capped. And in that particular respect, the Honorable Supreme Court had taken cognizance that you cannot overcharge in this particular pandemic because the people are having no resources of money, the people are having no resources of income. And under this circumstances, it is also duty because you are the citizen of the country. And you have also some semblance of social duty to help the common people. So, under this particular circumstances, the number of public interest litigation has been filed, including I have filed public interest litigation, that it is the duty of the state to protect the health and life of the common people. And I am there to enforce the Article 21 of the Constitution. I am not concerned with the cost which private hospitals are incurring. I am telling the government that you pay the private hospital, but you do the free of cost. Because it is a health emergency, it is a health crisis, and everybody knows. It is not that Honorable Supreme Court is not aware how the private hospital works. And it is also, every citizen of the country knows that the private hospitals are they are sitting to take money only, and 20% of the private hospitals are ruthless, merciless in taking money, and they are saying that no, I have a cost. I am not denying that you do not have cost, but you must understand the practical problems of the common people. You must understand the pandemic, where the people do not have any kind of way out. So in this particular circumstances, only a common people have only one resource to the court, look to the court and remind the court that it is your duty to check the excesses of from the private hospital and from the government. So under this particular circumstances, the public interest litigation is a safety valve, to the interest of the common people. Because I must add one thing, that what is the use of sovereignty if the government is to protect the life and liberty of the citizens? What is the use of sovereignty if some people are just losing money? I mean, it is unimaginable. It is not understandable. It is a huge problem. I think that the government must act immediately, swiftly, and take immediate decisions so that the thousands of people who are suffering from this particular disease may get immediate relief, and the government must do something immediately.
Dr. Munga, do you agree with Mr. Sudhir's view that hospitals are exploiting the situation? Private hospitals, sorry.
I'll only agree up to 50%. His sentence, I think, ruthless and merciless for hospitals is not correct. I mean, that's not in the right spirit also. And, maybe 1 to 5 hospitals in the country out of thousands, if somebody must have overcharged or somebody, we are not with that. But overall, branding all hospitals as ruthless or merciless is, I think, not doing justice as an advocate also, and I think he should control his emotions also. Shashankji is a senior advocate, but the point is, here it comes, that we are also agreeing on that Article 21 that the government should have done it. But if the government has not done it, private sector pitched in, they are giving you the best in the world medical services. They are improving all of the medical tourism also and bringing a name to the country. If the government has failed, it does not mean that you throttle the private sector over there. But yes, no exorbitant charges should be there, and there should be a limit to it. The government has already put the charges. The capping almost has been done, and all hospitals are agreeing to that. So there is no point in discussing it further anyway.
But Dr. Munga, want to agree that as you said, that private hospitals provide best medical care, but this best medical care is out of reach of many people, and even in this emergency situation. Do you want to agree? Because of charges, high charges.
Yes, I do agree. There should not be high charges, number one. Number two, the government has fixed the charges, and hospitals are agreeing to that and taking charges for that only nowadays. But definitely, Shashankji has a point. I will be happy if during this emergency all this corona care is taken up by the government, and let them pay the hospitals, and it should be free to the public. We are also, otherwise also, you and me are paying to the to the government hospitals for whatever they are doing. So let it be another part of the story.
But this situation of reliance on private hospitals has emerged only because the governments over the decades have not paid due attention to public health care. Public health care has almost failed. You are not able to rise to the occasion, isn't it?
Yes. That's what I'm saying. The government should have,
is overwhelmed. The hospitals are not prepared.
Shashankji, I'll come back to you. Let Dr. Munga first answer this.
That's my first part I said. After independence, the government should have improved their basics, their infrastructure, their hospital beds, their public health services. But I am very, very sorry to say that our government has really done nothing over the years and especially public health department is 0/0. But definitely, everybody is talking about secondary and tertiary care. Nobody has talked about the basics. You go to a village, you go to a block, you go to a district, and see the pathetic condition of government hospitals. You would never like to go in these hospitals and get admitted over there. That is why the private sector has kicked in. And, for a private sector, big infrastructure, most modern facilities, it comes at a price. But definitely exorbitant prices, or if somebody is reaching the public, we are not with that.
So let me turn to Mr. Sudhi. See, when we talk about that over-reliance on the private sector, because the governments have failed to take care of the government health care. And despite that, it is irony that India is a socialist country, has been a socialist country, and we have not been able to pay due attention to public health care. And when we compare maybe with the US, there are comparisons are made with the US, but US has the biggest and greatest public healthcare system, although we call it a capitalist country. How ironic is it?
Sir, it is a predicament. It is a very sad irony of this country, and it is a sham claim being made by the government that there is a national policy, for health. It is unfortunate. And my whole grievances against the government, my whole grievances is not against the private sector. So look at the situation. The health minister of this particular Delhi state has been admitted in the private hospital. What kind of assurance they are giving to the common people? The common people may not be getting any kind of facility in the private hospital because there is a great crowd in the private hospitals. But since he is a health minister, definitely they are getting entry and getting the accessibility of the private hospital. And I am telling you, I have certain, information where one advocate was willing to get admitted in the private hospital after making an adequate payment, but the private hospital refused to take it. So what I am trying to say, considering this particular circumstances and considering the many examples of neglect of the government hospital, the government is badly failed in every levels of containment of this particular pandemic. And the government hospital is totally collapsed. The entire health system of this particular country is overstretched. I am very sorry to say, that despite this new government, Modi government, there is absolutely a chaotic situation in the government hospital. There is no testing, there is no health bed, there is no medicine, and this is a common spectacle everywhere. And it is not one day problem. It is a problem which has been coming from last many years, ever since independence. My only point which I am trying to say is that the Honorable Supreme Court must take immediate attention to the dilapidated health system in our country and take a corrective step and direct the state government, respective state government, to upgrade all the government hospital to the level of the private hospital, and only solution lies in taking immediate and corrective steps in upgrading the government hospital, so that the common people must be tempted to go to the private hospital, because the private hospital are having facilities, but the government hospital are not having facilities. This is a disparity. Unfortunate situation, sir.
So, Mr. Shashank, we know that the situation is very unfortunate. We hope that the Supreme Court will take a holistic view of the healthcare system and maybe order a revamp or whatever, so that people in the need can really get the real, good treatment. Thank you so much. We are running out of time. Thank you so much for participating in this debate. This is all in the agenda today. Thanks for watching. I will come back with another important topic on Monday. Till then, goodbye.